Welcome to an educational module on provider communication regarding childhood vaccines. My name is Amber Burgad, and I am a Doctor of Nursing Practice student at North Dakota State University. I am currently working on my dissertation project with Dr. Heidi Saarinen, who is an assistant professor of practice at the university and is the chair of my project. The educational module will take about 1 hour to complete. Prior to beginning the educational module, there are 10 pre-test questions that need to be completed. Following completion of the module, there is an additional 9 post-test questions and an evaluation. The educational module is intended for any healthcare provider who cares for the pediatric population or who is interested in expanding their knowledge on communication styles regarding vaccines. The educational module reviews provider communication regarding childhood immunizations. This educational module is part of a Doctor of Nursing Practice clinical dissertation project. No funding was received to assist in the development of this educational module. This program was planned in accordance with the American Association of Nurse Practitioners Continuing Education Standards and Policies and AANP Commercial Support Standard. Upon completion of this module, you should be able to recognize factors contributing to the current childhood vaccination rates, identify barriers, communication styles, and healthcare provider interventions that affect childhood immunizations, identify effective communication styles for healthcare providers, and report enhanced confidence in provider practice when discussing immunizations with parents and their children after viewing the educational module while drawing from your previous experiences. This educational module will focus on childhood vaccines from birth through kindergarten. Vaccine development started a little over 200 years ago. Development of vaccines has been at a slow rate until the last several decades. This is because of new scientific discoveries and technologies that have led to advances in virology, molecular biology, and also vaccinology. With these advances in vaccine development, life expectancy in the 20th century has been positively impacted. Vaccines reduce infectious diseases and mortality. Studies show that vaccination with the current childhood immunization schedule prevents about 42,000 deaths, prevents 20 million cases of diseases, and saves $14 billion in direct costs. Healthy People 2020 provides science-based national objectives with a focus on the improvement of the overall health of Americans. One of the goals of Healthy People 2020 is to increase immunization rates and reduce preventable infectious diseases. There are currently 17 target vaccine preventable diseases identified from childhood to adulthood. These include varicella, tetanus, pertussis, poliomyelitis, rubeola, mumps, rubella, diphtheria, meningitis, pneumonia, Haemophilus influenza B, hepatitis A and B, shingles, rotavirus, and human papillomavirus. Being made aware of common preventable diseases and focusing on preventative health is a key component for reducing the spread of infectious diseases. Healthy People 2020's goal is to have all vaccination rates for each vaccine at or greater than 90%. Vaccines remain one of the most cost-effective preventative services and starts at birth. Childhood immunizations alone help save 33,000 lives, prevent 14 million cases of disease, and reduce healthcare costs by $9.9 billion. There has been a marked improvement in childhood immunization rates, yet concerns still exist. In 2011, only 84.6% of children aged 19 to 35 months had received all 4 doses of DTaP. MMR rates in the United States are at 91.9%. In American Indian and Alaskan Native ethnicity, there is only an 84.1% compliance rate. Pneumococcal rates in the United States are at 84.1%. In 2014, children completing both doses of hepatitis A was at 57.5%. Vaccine hesitancy and refusal has shown outbreaks of Hib, varicella, pneumococcus, measles, and pertussis. In 2000, measles was eliminated in the United States. In 2014, there were 644 cases of measles. Although there has been progress, 300 children in the United States continue to die each year from a disease that is vaccine preventable. Unvaccinated populations are at risk for outbreaks and put us all at a risk for new strains of diseases developing. Early vaccination in infants and children is vitally important. Newborns are born with some immunity from disease from their mother, but this also goes away within the first year of life. A child's immune system is weaker than adults and may not be strong enough to fight off some diseases. It can also take longer to produce antibodies or develop immunity from disease after disease exposure or vaccination. According to the Centers of Disease Control and Prevention, the current vaccination recommendations for children for 2017 include the following: hepatitis B, 3 doses by age 18 months; rotavirus, 2 or 3 doses by age 6 months, depending on which vaccine the child receives; DTaP, diphtheria, tetanus, and pertussis, 5 doses by age 6 years; Hib, Haemophilus influenza type B, 3 or 4 doses by age 15 months, depending on which vaccine the child receives; pneumococcal, 4 doses by age 15 months; polio, 4 doses by age 6 years; influenza, yearly starting at age 6 months; MMR, measles, mumps, and rubella, 2 doses by age 6 years; varicella, 2 doses by age 6 years; and hepatitis A, 1 dose by age 23 months. This schedule is designed and implemented to protect children early in life, as this is the time that they are most vulnerable to diseases. The CDC and Advisory Committee on Immunization Practices issue annual recommendations and guidelines for immunizations. The guidelines provide evidence-based recommendations of scheduled vaccines that are safe and effective for the population based on age and medical conditions. It is the role of the healthcare provider to do self-education annually to be up to date on the most current recommendations. The recommendation of a healthcare provider plays a powerful role and motivational factor for parents regarding compliance of current childhood vaccination recommendations. The positive opinion and recommendation of a healthcare provider has shown positive effects on the parent and/or patient response and agreement to immunize. There continue to be missed opportunities for childhood vaccination due to a variety of barriers. Studies have shown that elimination of missed opportunities by addressing vaccines at every visit can increase childhood vaccination coverage by 20%. Strategies recommended to the patients and parents in regard to pediatric vaccines to prevent missed opportunities include provider recommendation, reinforcing the need to return for future vaccination, and reminder and recalls to patients. Vaccine resistance includes parents that refuse vaccines. This consists of about 1 to 2% of parents nationwide. Vaccine hesitancy includes parents that are hesitant about or elect to delay vaccines. This consists of about 11 to 19% of parents nationwide. These behaviors can lead to outbreaks of vaccine-preventable diseases across the country. Positively influencing vaccination rates starts with effective communication and counseling the parents and patients about the vaccines and about the diseases that they prevent. Many of these parents and patients are not aware that their child may need vaccines or what vaccines they need, often thinking that they are up to date on their vaccinations. The review of literature reveals that the following factors affect vaccination rates in the United States. We will discuss each of these in the following slides. These include vaccine barriers affecting childhood vaccination rates, effective communication styles, ineffective communication styles, and healthcare provider interventions to aid in increased vaccination. The following are factors contributing to current vaccination rates. In the United States, there is an increasing number of parents having concerns about vaccines for their children. These concerns include receiving too many vaccines, the ingredients in the vaccines, side effects of vaccines, and the importance of vaccines. It is important for the healthcare provider to communicate to the parent that these vaccines are safe. Communication from the healthcare provider should include acknowledging the parent's concerns and provide truth and evidence of safety. The next slide will look at each of these concerns a little closer, with evidence showing safety and effectiveness. These concerns lead to increased vaccine exemptions and use of alternative schedules with vaccine-hesitant parents. Studies have shown a rise in the rate of vaccine exemptions for kindergartners and an increase in the use of alternative vaccination schedules. The number of children with incomplete primary vaccine series by kindergarten is below the Healthy People 2020 goals overall. The overall exemption rate in kindergarten in 2014 was 1.8%. In a number of states in the United States, vaccine exemption rates continue to rise over the last 5 years, in some states even doubling. These states include Connecticut, Florida, Iowa, Kentucky, Maryland, New York, North Carolina, North Dakota, Ohio, Oklahoma, and Virginia. These increases in exemption rates lead to an increased incidence of vaccine-preventable diseases in the United States. For vaccine-hesitant parents, vaccine safety has been reported as the biggest concern. Communication between the healthcare provider and parents directly affect whether vaccines are given to the child. Communication styles can contribute to rejection or denial of offered vaccines. Effective communication between the provider and the parent can help motivate a vaccine-hesitant parent towards vaccination and can offer support to the parents who support vaccines. Vaccine barriers can have a negative effect on overall vaccination rates and directly impact morbidity and mortality. Multiple studies have shown that due to the results of vaccine availability, vaccine-preventable diseases have seen a decline in mortality and morbidity. As of 2016, diphtheria, polio, and smallpox have seen a 100% reduction. Measles and rubella have seen a 99.9% reduction. Mumps has seen a 95.9% reduction. Tetanus has seen a 92.9% reduction. And pertussis has shown a 92.2% reduction in mortality and morbidity in the United States. The following are identified to be specific vaccine barriers affecting childhood vaccination rates as directed by current literature. Parental concern regarding safety and necessity of vaccines is a major factor and barrier affecting childhood vaccination rates. Vaccine-preventable diseases are becoming less common due to more children being vaccinated and more vaccines being available. Unfortunately, This can negatively affect vaccination and disease rates, as parents are now expressing more concerns about safety and necessity of vaccines. A major reason for this is that parents are not seeing these diseases and wondering about the need to continue to vaccinate against them. Parents are showing concern with both immediate and long-term side effects of vaccines. In a survey of 13,000 parents, children 8 months to 35 months of age, the most common cited barrier to vaccination was the concern about side effects. Some parents have been found to focus too much on possible immediate side effects of vaccines, such as rash, swelling, or pain. These are then used to rationalize their reason to avoid vaccinating their child altogether. This can lead to delays in immunization, under-immunized children, and further questions for the healthcare provider during office visits. Any vaccine can cause side effects after administration. Most of these are mild and will subside after a few days. These are studied each year by the Advisory Committee on Immunization Practices, or the ACIP, for each vaccine. Vaccines pose a risk to receive the vaccine and a risk not to receive the vaccine and develop the illness. With most side effects of vaccines being mild and only lasting a few days, this risk would outweigh developing the illness or disease. A vaccine information sheet is provided to the parents with information regarding each vaccine. It is important for this to always be the most current edition date. This has information on who should get the vaccine, why they should get the vaccine, who should not get the vaccine, the risks of the vaccine, including mild problems, moderate problems, and severe problems, and what to do if there is a serious reaction. The link to the most current vaccine information sheets on the CDC website is listed above. Another great parental concern is the number of vaccines required during childhood. There are more recommended vaccines today than there were 20 years ago. From 1990 to 2000, 4 diseases involving 10 to 12 injections were added to the ACIP recommendations. Currently, 10 vaccines are in the recommendations between birth and age 10. Some parents question this and have shown concern that giving too many vaccines at one time can cause harm to their child and may overwhelm the child's immune system. Recent national surveys have showed that 23% of parents question the number of shots recommended for their child, and 25% of parents are concerned that the vaccines will weaken their child's immune system. This is a result from younger parents not seeing the diseases that vaccines prevent. Studies have shown that the antigen receptors indicate that the immune system has the capacity to respond to a large number of antigens. It has been estimated that if a child received 11 vaccines at one time, about 0.1% of the immune system would be used. Vaccines may cause a short-lived immunosuppression. This has not been found with all vaccines and does not result in an increased risk for infections. Studies have shown that some vaccine-hesitant parents prefer their children acquire disease naturally. It has been reported that this belief is that the human body protects itself from serious complications of vaccine-preventable diseases. Other reports from parents include that their belief is that some vaccine-preventable diseases are not dangerous, their child may not be at risk for the diseases, or that if these diseases are acquired, that they can easily be treated. Other religious and moral barriers found with vaccine-hesitant parents include concerns about prior use of fetal tissue in the manufacturing of vaccines. 2 human cell strains have been used in the development of currently available vaccines. These include hepatitis A, rubella, varicella, zoster, adenovirus, and rabies vaccine. 2 fetuses have given rise to the human cell strains used in vaccine development. This took place in the 1960s. Neither abortion was reported to have been performed for the purpose of vaccine development. Fetal cells were used only to begin the cell strains used in vaccine development. Vaccines made with these two cell strains have prevented nearly 11 million deaths and prevented 4.5 billion cases of disease. Vaccine exemption is allowed due to medical reasons in all states in the United States. Exemption is allowed due to religious reasons in all states except for California, West Virginia, and Mississippi. It's allowed due to philosophical reasons in North Dakota, Minnesota, Wisconsin, Michigan, Ohio, Pennsylvania, Vermont, Maine, Washington, Oregon, Idaho, Utah, Colorado, Arizona, Oklahoma, Texas, Arkansas, and Louisiana. There is 1 to 3% of children in the United States excused from immunizations because of these exemptions. In some communities, the rate is up to 20%. This rate is affected by both poverty level and is influenced by the states that allow exemptions versus the states that don't allow exemptions. These communities are then put at a greater risk for disease outbreaks. Suboptimal communication between the healthcare provider and parent has been shown to result from the healthcare provider's belief that vaccine refusal arises from ignorance of the parent. This can be addressed by providing information to these parents. Other causes are language barriers and insufficient knowledge in regards to vaccines. These lead to reduced vaccine adherence. A study of 1,600 parents showed that many parents indicated that they need more information about how vaccines work, side effects of vaccines, and new changes to vaccine recommendations. Lack of access to healthcare is directly related to socioeconomic and other factors such as poverty, lack of transportation, and clinic hours. Some parents are unaware that they may qualify for Medicaid or other resources of healthcare coverage. Parents of lower income brackets and of lower educational level report greater concern regarding the need for vaccine. This group has also been shown to be more trustworthy of and look towards social media information regarding vaccines than they are with the medical community due to poor healthcare access. African American children have shown a lower vaccination rate for DTaP, Hib, pneumococcal, and rotavirus when compared with Caucasian children. Healthcare providers report barriers to vaccines as well. This includes the time needed to address vaccine questions during their clinic visit, the lack of perceived trust in the provider's recommendation, and the struggle whether to refuse treatment of vaccine-hesitant parents due to the risk of disease exposure with their other patients. At a well visit, the provider is checking physical, cognitive, and other childhood milestones. It has been found that there is often not enough time for the provider to address all concerns and questions regarding vaccination. There are some parents that have a lower perceived risk of vaccine-preventable diseases with a decline in disease. This makes it challenging for the healthcare provider to communicate a need for vaccination to the parents. The main provider barriers to vaccines include lack of knowledge, poor access to records, missed opportunities, and poor communication with parents. The number of recommended vaccines for children has increased over the last decade, requiring providers to keep up to date on the current recommendations and schedules. Many providers rely on their nursing staff to discuss current vaccine recommendations as they are the ones that administer the vaccine. Missed opportunities happen when vaccines are not addressed at every visit, including sick visits. This is important as when children get older and are generally healthy, they may not come into the clinic regularly as they previously did. One study showed that children who had a missed opportunity were 3.1 times more likely to be incompletely immunized. A major factor in shaping parental attitudes towards or against vaccination is the interaction between the parent and the healthcare provider. Effective communication and interaction between the two can address concerns and questions, helping the parent make an informed decision. Ineffective communication can negatively affect the parent's decision to vaccinate and even display dissatisfaction with the overall healthcare provider's care. Healthcare providers continue to be the most important and trusted resource for vaccine information, and their recommendation of vaccination is one of the most important factors to improve vaccination rates. According to the CDC, this has been shown true for even parents with the most questions and concerns. A strong personal relationship between the parent and healthcare provider aids in helping support parents in understanding vaccines. Vaccines should be addressed at each encounter the healthcare provider has with the parent and child. Goals at these encounters will vary depending on the parent's readiness and acceptance of vaccines. At each encounter, the healthcare provider should focus on building a relationship, building rapport, accepting and addressing questions or concerns, and helping facilitate consent for vaccines while providing information from reliable sources. Building trust is the first step, an important factor in establishing a relationship between the provider and parents. Trust has been shown to be established by the healthcare professional when they spend time with the child and parent, listen to and address their concerns, know the scientific information behind vaccines, and also by using a holistic approach to treat them as individuals. The number one factor that affects determining trust in vaccine hesitant parents is a healthcare provider that listens, cares, and shows empathy. This was found in 50% of individuals. The next trust factors were equally found at 15 to 20% of individuals. These consisted of openness and honesty, competence and expertise, and dedication and commitment. Communication is both the words that are said and the body language that the provider portrays. The body language and communication play a large part on establishing and building a trusting relationship. It is important to avoid distraction during patient visits. One major distraction is using the computer while talking to the parents. A positive body language and communication method can be achieved by using open-ended questions and showing empathy with responses. This shows that the healthcare provider fully understands parental concerns. We will now take a look at 3 effective communication styles. According to literature, effective communication styles include guiding style, motivational interviewing, and a presumptive style. A guiding style. For any hesitant vaccine parent, the healthcare provider should use a guiding style and elicit the parent's own motivations to vaccinate, while avoiding any excess persuasion techniques. Parents report that using a guiding style of communication by the provider, such as focusing on how they can help the parent, is an effective technique. Other guiding style strategies include showing care with their body language, eliciting parental concerns, asking permission to discuss concerns, acknowledging, listening, and empathizing with the parent's concerns, determining if there is readiness of parental change, informing parents about the risks and benefits of immunization, and by giving appropriate resources. This communication should be a two-way conversation between the healthcare provider and parent. This can be achieved by taking time to listen, asking and welcoming questions, and keeping the conversation going. Listening can be achieved by giving the parents full attention during the visit, maintaining eye contact, restating concerns to show and verify understanding, and pausing to process your thoughts, as well as give the parent time to ask a question. Welcoming questions can be achieved by using open-ending questions and showing interest in their concerns. The provider should put themselves in the parent's shoes and acknowledge their emotions. Keeping the conversation going can be achieved by acknowledging the parent's concerns for vaccines and showing that is important to the provider as well. Motivational interviewing. Motivational factors encourage, influence, and guide one to a decision. They are considered a positive and important component of successful behavioral change. They can be used to encourage vaccination. Provider recommendation for vaccination has shown to be a motivational factor in several studies. One approach to this is motivational interviewing. Motivational interviewing includes asking the parents what they are most worried about and to describe their understanding of the disease risks, vaccine risks, and vaccine benefits. This involves asking questions to clarify the parent's response to change and elicits their own motivations for change. This has demonstrated the effectiveness of health behaviors, such as positive influences on immunizations. Motivational interviewing is patient-centered, goal-directed, and a focused approach to initiate change. The basic approach to this involves using open-ended questions to invite elaboration and thinking, affirmations to recognize strengths and help build rapport, using reflective listening to show the patient that you understand, and by using summaries to recap and communicate interest. This is the first of 3 case studies to help augment learning during this module. Case study number 1. A 6-month-old child comes into the clinic today with her mother for a well child exam. She has received her birth, 2-month, and 4-month shots without any problems, questions, or concerns. Today, the mother states to the healthcare provider, "I just don't understand why my daughter needs all these shots at the same time. I would like to only do 2 of them today." What effective communication strategies can be used by the healthcare provider when speaking to this mother? I will give you some time to think about this case study. This mother's concerns can be addressed by the healthcare provider using a guidance style and motivational interviewing. Using effective communication, the healthcare provider could say, "I understand you are concerned with the amount of vaccines given to your daughter at one time. There has been no proven risks or dangers associated with a child receiving multiple vaccines at the same visit. Delays in vaccination can put your child at risk for developing those diseases. We can go ahead with only 2 of the vaccines today if you're uncomfortable with the amount of vaccines given at once. With this, I would then like to see you and your daughter back in 2 weeks for the rest of the vaccines. This alternative schedule is not recommended. What other thoughts or questions do you have?" With this response, the healthcare provider is eliciting the parent's concerns, acknowledging, listening, and empathizing with the mother, informing of risks and benefits, giving appropriate resources, using open-ended questions, all while encouraging and guiding to a decision. Presumptive style. According to the American Academy of Pediatrics, researchers have found that pediatricians who use a presumptive style of communication were more likely to see acceptance regarding vaccines from parents. This style involves using a presumptive recommendation, such as informing the parents that vaccines are due today, instead of asking the parents what they think about getting vaccines. This includes using phrases such as, "These are the shots scheduled for your child today." In one study, 83% of parents resisted the healthcare provider's recommendations for vaccines when they used a participatory rather than a presumptive style of communication. Case study number 2. A 4-year-old child presents to the clinic today with her mother for a well child exam prior to starting kindergarten. The healthcare provider knows from previous experiences that this mother has been vaccine hesitant with her other children at times. What is an effective way to communicate the need for vaccines today with this parent? I will give you some time to think about this case study. With this case study, the healthcare provider should use a presumptive style of communication when addressing vaccines today. Using effective communication, the healthcare provider could say, "Your child is due for 4 vaccines today: DTaP, IPV, MMR, and varicella. These can be combined into 2 shots. First one is DTaP and IPV, protecting your child from diphtheria, tetanus, pertussis, and polio. The second shot is MMRV, protecting your child from measles, mumps, rubella, and varicella. She is due next for her influenza vaccine in October." We will now take a look at 2 ineffective communication styles: directing style and participatory style. Directing style. When addressing parent concerns in regards to vaccinations, parents report that using a direct style of communication by the provider, such as telling the parents what to do, is an ineffective technique. This direct style focuses more on what the provider thinks the parent should do. The provider is felt to be interjecting personal biases and opinions instead of providing evidence-based facts. Other directive style strategies include using information and persuasion to change the parent's mind about vaccines, missing cues and not listening, using jargon, discrediting information sources, overstating the safety of vaccines, and confrontation. Participatory style. According to the American Academy of Pediatrics, researchers have found that pediatricians who use a participatory style of communication were less likely to see acceptance regarding vaccines from the parents. This involves using a participatory recommendation, such as asking parents what they think about getting vaccines today, instead of informing the parents that vaccines are due today. This includes using phrases such as, "What do you think about shots today?" One study showed that more of a participatory discussion style used by the provider resulted in a higher level of vaccine resistance. Case study number 3. The following are examples of ineffective communication regarding vaccines from a healthcare provider by both the directing style and participatory style. "Your child needs to get their flu vaccine today. You shouldn't worry about the side effects. The flu vaccine is 100% safe. Do you think you want your child to get the flu shot today?" How should we reword these during discussion to have a better, more effective communication style
with the parent when discussing immunizations. I will give you some time to think about this case study. The first two statements, your child needs to get their flu vaccine today, and you shouldn't worry about side effects, vaccines are 100% safe, are examples of directing style of communication. These are ineffective. The first statement is directing the parents to what they need to do and focuses more on what the provider thinks the parent should do. The second statement is discrediting information sources and overstating the safety of vaccines. The third statement, do you think you want to get your flu shot today, is an example of a participatory style of communication. This is ineffective. To reword these and make them effective, we should use a presumptive style, guiding style, and motivational interviewing. An example of this is your child is due for their flu vaccine today. Mild side effects include soreness, redness, or swelling at the injection site, fever, aches, headache, itching, and fatigue. If these would develop, they last 1 to 2 days. The risk of the vaccine causing a serious reaction is rare. Here is a vaccine information sheet that has all the information regarding the vaccine and everything we discussed. What questions do you have for me? Healthcare provider interventions that have been shown to improve vaccination compliance among children include counseling, maximizing opportunities, offering combination vaccines, improving accessibility to vaccinations, and using electronic medical records. Effective counseling can be accomplished through informing the parents and child about vaccinations, making strong recommendations, providing the patients and parents with educational materials, using good communication strategies, dispel myths about side effects, educate about current research, give time to discuss parental concerns, describe infections that vaccines can prevent, describe potential health and financial consequences of noncompliance, provide a vaccination record with past and future vaccine visits, provide reminders to the parents, have vaccine hesitant parents sign an exemption form, and inform parents that a missed dose will not require restarting a vaccination series. Maximizing opportunities include addressing vaccines at every visit and issuing standing orders to allow the nursing staff to administer vaccinations. By addressing these during patient counseling, the provider can have a positive impact on vaccination rates. I've personally seen this work well by including nursing staff to help address vaccines with parents. Prior to the patient arriving, nursing staff can look up each child and see what they are due for. During the rooming process, they are able to discuss these vaccines with the parent prior to the healthcare provider entering the room. This will allow the healthcare provider to be able to address any questions the parents have regarding the vaccines that the nurse spoke with the parent about. This can allow for better use of time and patient flow. Combination vaccines can be offered to reduce the number of injections for parents, reducing the return for visits, and simplifying the vaccination schedule. This will all help in an improved patient adherence. In the United States, more than 2/3 of under-vaccinated children under the age of 2 has been attributed to a missed opportunity in the clinic. After age 2, most children are brought into the office for illnesses, as parents have been found to believe that they are done with immunizations at age 2. Studies have shown that utilizing these visits for immunization opportunities have reduced the child's subsequent need for care. To improve accessibility of vaccines, healthcare providers can allow same-day appointments and walk-in visits for parents to come when they are able. train their staff to be friendly and welcoming, provide office hours that are convenient, and limit the wait time of the patient. Electronic medical records, or EMRs, are also becoming more popular in today's medicine. By using EMRs, the healthcare provider can consolidate immunization records, set alerts for needed vaccines, and follow up electronically with parents to come back in for immunizations. EMRs have been shown to improve efficiency and accuracy of immunizations. Next, we will see a video demonstration that will discuss communication with parents from the perspective of multiple pediatricians. Permission for use of the video in its full original form was granted on 12/18 of 2017 by Peggy Beck, Vice President and Editor-in-Chief at MedPage Today.
The study was interesting in that it really highlighted the importance of the way we bring it up in parental vaccine acceptance or refusal. Typically, I've always offered it more so as I would any other medical therapy. You know, your child needs these 5 vaccines today, rather than, do you think you would like to give your child vaccines today?
Usually I do it by approaching them with the fact that their child is due for immunizations or is behind on immunizations and we need to get them updated. And I offer them the vaccines that I think or are recommended at that particular time.
The first thing I try and identify is where the resistance is coming from, and acknowledge that is important. I think that we share a priority that we both want the best thing for their child, but we may come at it from a slightly different angle.
In my clinical experience, I take care of mostly Latino, Spanish-speaking families. The nice thing about Latino families, especially first-generation immigrant parents, is that they have a very rich understanding of the connection between public health and vaccinations. So I don't often get parents that refuse vaccines, but it will occasionally happen. And they usually say something like, I've heard that this vaccine may cause this side effect. What do you think about that, and what do you recommend for my child? So if it's a very gentle introduction to a question or just a concern that a parent has, that's usually a conversation that goes very well. I will say, well, you know, the evidence doesn't show that these two things are linked with this vaccination and this problem, or in my experience, I haven't found that to be a problem among the patients that I see.
What I try to do is reassure people that the vaccine is safe, it is effective, and the reason it has to be done every year is that flu changes. If a parent is still resistant to getting vaccines, one of the things that I'll bring up is car seats and seat belts. Let's face it, the chance of you being in an accident on any given day, on any given trip, is fairly low. Flu vaccines are very much the same thing. In all likelihood, people are not going to get the flu. The majority of people don't get it. But if you do get it, you're going to be really sick.
I've had just a number of patients over the years that initially were vaccine refusers, and I continued to see them and build my relationship with them, and sooner or later we found that they were more than willing to start having immunizations. There are very few patients that I have built a relationship with over time who continue to refuse immunizations.
Occasionally, though, people will maintain that they think commonly that their child is too young to get a certain vaccination, that their child isn't strong enough to get a certain vaccination. And I try to inform those parents that these diseases that we protect against with a vaccination are diseases that many people don't have any experience with because they've been gone for so many years, and people don't think that they're real anymore.
Right now, a lot of parents are concerned about the risks of autism or, you know, risks to their immune system, or frankly, they haven't seen any of these vaccine preventable illnesses, which is a great thing. But I explained to them that we're seeing more and more cases of vaccine preventable illnesses because parents do refuse vaccine. And then I'll often go through the studies about vaccines and autism and explain why those studies aren't particularly valid.
There are things that I have seen myself, both as a trainee and a practitioner. I've seen whooping cough And we've had whooping cough epidemics certainly in Arkansas and other parts of the country. And so I try to tell the parent why that particular disease is so dangerous or potentially dangerous for their child, and try to address their concerns in that way.
I think we've known for some time as pediatricians that we need to be very careful in our language when we approach the subject of vaccines with parents, and especially now that more and more parents are resistant to vaccines. And I think this really validated what we already knew, that we need to really choose our words carefully if we want to make sure and protect our patients from these potentially harmful illnesses.
I began to feel a little bit like I wasn't quite doing the job I should, because I'm not as forceful as the many physicians who were very successful in getting a high percentage of children immunized. I do think that if you looked at it over the course of several years rather than just one limited time frame, you'd find that an approach of building trust and relationship probably leads to just as many immunized kids.
I try and share some of the information that I've learned over my time as a health professional, as a pediatrician, and I try and identify specific issues with science if that's possible. But ultimately, I make a strong recommendation to every parent that I believe that this is in the best interest of their child, and I recommend they proceed with the vaccines, as I have for my own children.
Studies consistently report that when providers do not recommend vaccines or do not strongly provide vaccine recommendations during an office visit, patients often decide not to vaccinate or just ignore the topic of vaccination altogether. Effective communication between the provider and the parent can be achieved by addressing barriers to immunize, practicing good communication skills, and using an evidence-based approach to the communication. The healthcare provider's ability to effectively communicate information is a major aspect in establishing a successful relationship with the parent and the patient. In order to effectively communicate, the provider needs to build a rapport, be empathetic, provide support, build a partnership, explain and evaluate understanding, practice cultural competence, and establish trust. This has been shown to allow the healthcare provider to understand the parent and patient's point of view and use this to develop a treatment plan regarding their health. Healthcare providers may find personal benefit from vaccine communication education. Their recommendations have been found to influence vaccine-hesitant parents to immunize their children. It is important for the healthcare providers to be up to date on immunizations and recommendations, as these do often change. It has been found that providers are the most trusted source for vaccine information among parents. One study showed that parents who were initially a refuser or a delayer in vaccinating their child cited the healthcare provider's advice for changing their decision to vaccinate. These vaccine-hesitant parents do often seek healthcare providers' recommendations. By being up to date and fully educated on vaccines, healthcare providers can make a positive influence on vaccine rates. The reason for vaccine delay and refusal will change over time. To keep up with this, healthcare providers must continue to assess the reasons why some parents choose to delay or refuse vaccines. This will allow for the appropriate healthcare provider education to address these concerns. Multiple studies have shown that healthcare provider recommendation of vaccines shows significant impact on the receipt of vaccines in children. Healthcare providers' approach to communication plays an important role in this. By using more of a guiding style, motivational interviewing, and presumptive style communication can result in a lower level of vaccine resistance. Thank you for your participation in this module.